difference.
Hello there, Saturday morning. You're watching Breakfast with Rachel Burden and John Kay, 7:30.
And we're going to hear more about how the lockdown in England might be eased on Monday. We've had the first confirmed indication, haven't we, of a little bit of the easing of restrictions.
In care homes, yes. We're going to speak to one of our regular GPs in a moment. Dr. Fari Ahmad is going to join us from Wilmslow. Good morning. Thanks for joining us, Fari. It's interesting, isn't it, looking at the papers this morning. I don't know if you've had a chance to look at them yet, but they're all suggesting little possibilities in terms of lockdown being eased.
And I think it's really important to make sure that we still have all these precautions in place. We're heading in the right direction. Certainly, you can see this light at the end of the tunnel, but it's important we don't stumble now and we keep on top of things. And I think it's important that people don't think, right, I could ease off now. If anything, it's even more important that we just hold it and I know it's been hard, but I think it's just important that we stick to the, hand washing, social distancing, wearing the masks, keeping away, just for a little bit longer, because, even if you've had the vaccine and it'll stop you getting, COVID bad enough to need to go to hospital, potentially you could still pass it on to other people. There are other people who haven't had it. And we need to get the rates low enough so that there's not much of the virus transmitting between people. So I think I should be okay to pop round and say, well, I don't think that's quite right. And you've had to pull people back. And, I do understand, people are desperate to see people you love. But, we're nearly there. We're not quite at that stage. So just hang fire.
Don't go too quickly. Don't go too quickly. There's some really depressing stuff. A report I've seen this morning.
They can't, get to do the things they would normally have expected to do. Some of them aren't happy that, everything's happening on the phone first. So, and I think, we're probably a bit more accessible than other, areas of the health service. So, we are seeing it. And I think, sometimes it's the receptionists who bear the brunt of it. I've, certainly heard stories of people in tears because of what other people have said to them on the phone.
Dr. Fari Ahmad, thank you very much indeed for joining us early this Saturday morning. We appreciate your time. I'm just trying to work out how many times we both use the word patient in that, or patience in that discussion. It seems to be the watchword for the day, doesn't it?
Monday the 28th of February on BBC One and iPlayer.
Good morning, everybody. Welcome to Breakfast with Rachel Burden and John Kay.
And here are our headlines today.
Part-time model. They wanted a model in which they'd be self-funded, so they wouldn't be constantly criticised and attacked, and the racism wouldn't be justified as taking taxpayers' money, and they wanted to support the Queen at the same time, a part-time model. And I have to say that I think this is a loss, because the question of the minor royal needs to be looked at. European royal families, this is how they do it. The younger sibling, they have a job, but they also support the monarch. And Harry and Meghan's model, I think, would have been very successful. It would have kept their star power within the royal family. And I think going forward for the 21st century, are we really saying that Princess Charlotte and Prince Louis, that they have to, if they want to be a doctor or an archaeologist or a school teacher, they can't do that. They have to spend their entire time living off the crown and doing royal engagements to back up their sibling. That the role of the younger sibling is always to back up the...
Isn't the question, though, that they don't want to be school teachers or archaeologists? What they want to be, it appears, they're doing philanthropic work, but they're also being stars, celebrities. And it's that balance, isn't it? That clash, really, between the celebrity world and royal world.
Well, I think they can't help being stars. That's the thing. Whatever Harry and Meghan do is covered to a huge degree. They did a small Zoom call with a local poetry group, was all over the place.
The new rules allow residents to receive indoor visits from one person, one specified named person, but they will be able to go in regularly. They'll be able to hold hands, that will be allowed, but they won't be able to get closer than that.
And the visitor must test negative for coronavirus before entering the home. PPE must also be worn at all times. Well, let's hear now from the Executive Chair of the National Care Association, Nadja Ahmed. Good morning. How much
in any way? So there will be all sorts of things about mitigating risk, but the baseline that the default is we want to enable this visiting.
Well, thank you very much. As you say, it sounds like a simple headline, but there's an awful lot of detail to be worked out here. Thank you very much, Nadra Ahmed from the National Care Association.
I'm wondering what it's going to feel like when I get it.
What do you think it will feel like? What are you expecting?
Like, when I can't explain it.
But you're looking forward to all sorts of things, aren't you? Tell us what are the things that you're most excited about?
I'm most excited to do like doing my counting and doing my shoelaces.
You know what? Yeah.
And Charlotte, this is much more, this bionic arm, sophisticated than, I suppose, a standard prosthetic. Tell us a bit more about how it operates, how it...
Movement. So, I mean, obviously, it takes some getting used to when she'll first get the bionic hand. But after a while, she should be able to do absolutely everything once she gets to grips with the finger movements and stuff.
You say a court ruled Matt Hancock had acted unlawfully when his department didn't reveal details of contracts signed during the pandemic. So the judge ruled the health secretary breached his legal obligation by not publishing details within 30 days in a substantial number of cases. Now, of course, during the pandemic, as people have heard, the government struck deals worth millions of pounds to provide goods and services. The judge said that he recognised that it had been an unprecedented situation, but said that was an excuse, not a justification. In terms of what the Department of Health and Social Care are saying, they're saying they often had to award contracts at speed to secure vital supplies, to protect the NHS, to protect the public as well. They recognise the importance of transparency, and they'll continue to publish information as soon as possible. But this comes off the back of frequent accusations from the Labour Party of cronyism. They've repeated that accusation overnight, and they're saying they want all outstanding contracts published by the end of this month.
Coming days. Back to you two.
A bit of sunshine to follow. Thank you, Thomas.
12 minutes past 9. It has been another big week for coronavirus developers. We seem to say that every week, but we have had this moment that we passed, the vaccine rollout, getting past the first major target that the government set of vaccinating the 4 most vulnerable groups by mid-February. So that happened last Monday, didn't it? And then we've had cases and deaths dropping as well across the UK. So
attention now inevitably turning to how we get out of lockdown. What is the roadmap out of it? And so we thought we would do, as we have done the last few Saturdays, put some of your questions that you've been sending in to our experts, Dr. Chris Smith and Professor of Public Health, Linda Bauld, who are both here to turn their attention to what you've got to say. Can I just ask you, let's sum up very quickly, both, maybe Chris to start with, kind of how important a week do you think this has been?
Achieved, and it's continuing at pace. And we're seeing numbers coming right down. We've got there's optimism for the weekend in some parts of the country as well.
Yeah, everything is caveated, but we're used to that with this virus, Chris. And Linda, from your point of view, does it feel like the right down now to be edging out of lockdown? Obviously, in Wales, we've got primary school children going back next week, some children going back in Scotland next week as well, and then talk about England schools. But the care home announcement today is significant too. It's in a few weeks' time. But is this the right time for those kinds of measures?
I think now is the right time, definitely, as governments are going to this week talk about what the roadmap will be, and to start with some gradual easing. Entirely appropriate to start with children returning to school, and also the pressure on making changes on the care home visiting has been very strong. Let's keep in mind that there are some families who haven't seen their loved ones in care homes since March. So I really welcome that announcement. I would say we still have to be cautious. Let's not forget that the NHS has treated over 100,000 severely ill patients in the last month, and we still have almost 20,000 people in hospital this morning, and it's definitely much milder here in Edinburgh today. So I think we should be feeling optimistic and looking ahead.
And you've got your daffodils as well. That's good. Right, Linda, let's start with a question we've got from Mariam, who wants to know from you, is the falling death rate that we've seen over the last few days, to what extent can we say that is the result of vaccines or of lockdown?
More evidence, I think, of being more confident about the impact that the first dose of the vaccines is having on mortality and potentially admissions to hospital. So, John, in the over 80s, we know there's been about a 60% reduction in mortality looking across the UK. And importantly, in Scotland, actually, where we started with the care home residents, we've had a 62% reduction in deaths in care homes over the last 3 weeks.
Yeah. Well, that's really interesting, as you say. What about in terms of the vaccines going down through the lower age group? Chris, we're beginning to hear about people in their 50s now having vaccination.
This is nothing short of a miracle, really, scientifically and politically and logistically, to be in this position. Just going back to the point that Linda was making about the evidence for the effect of the vaccine versus the effect of the lockdown, because obviously when you've got two things going on, it is difficult to disentangle them. There is some evidence initially that there may be a sign that the vaccine is already impacting on mortality, because one way to find that answer is you compare the rates at which infections are occurring in the groups that have been vaccinated and the groups that haven't been vaccinated, interrupting the chain of transmission and reducing the rates of infection in those people who've received it so far.
Interesting, isn't it? I guess that becomes clearer as the weeks go on, as we look through the data. Chris, Anna has been in touch with a question for you this morning. She says, all nations of the UK are trying to decide about unlocking, lockdown.
Now we have vaccines and we have a very significant proportion of people being vaccinated, which means that we've got a big counterbalance on our seesaw, so we can afford to move things a bit further than we had before. And so therefore, I do anticipate that inevitably, if you open things up and start doing more things than we were doing before, you're causing more contacts between people, and therefore you're going to cause more infections. But those transmissions won't necessarily run into and turn into cases in hospital, unfortunately losses of life either, in the same way that they were previously. So we have to be optimistic. We're going to be able to do this. We have to expect that there will be an elevation in transmissions, but this can be mitigated.
This is why, Linda, they are desperate for us not to start modifying our behaviour yet. And it's a question, I know our GP earlier, who we spoke to, gets asked a lot, and this has come through from Tom today as well, who's in the vulnerable group and says he had his first jab 3 weeks ago. So therefore, we know that he will have some level of protection at this stage.
Interesting new findings out this week on dosing. In fact, there are quite a few dosing papers. It was a busy week for evidence on dosing. What we knew from the past, Rachel, was that, of course, when the MHRA announced the approval of the 2 vaccines that we've been using in the UK, they did say they thought there would be pretty good protection after 3 weeks. It shows that actually, when you look at the final about 2 to 4 weeks after the first dose, protection was over 90% in that reanalysis of the data. And then a really interesting paper from, again, Israel in healthcare workers, where they looked at differences between those that had been vaccinated and not in the period from 15 to 24 days. And they found that infection was down 75% and disease, COVID-19, down about 85%. So that suggests you do have some protection, but it's not full protection. And the other thing is we don't know yet about transmission in vaccines, although we may be hearing some results on that quite soon. So it's absolutely crucial, while we still have high rates of infection in the community, that people who are currently following the public health guidance, even if they've had their first jab, they shouldn't be changing their behaviour. To ease gradually, we'll be able to do some things, but we won't be able to fundamentally change our behaviour for some time.
OK, thank you.
Linda, I mean, it's one thing we haven't mentioned so far this morning is that increase in the number of people who are shielding now. The government sending those letters to, nearly 2 million people saying...
So there was 1.7 million people added to the shielding list in England as a result of a risk assessment model that has been developed that gives more tailored advice for individual and looks at a combination of factors: age, sex, ethnicity, BMI, where people live and their health conditions. For shopping slots and for access to medicines to get help to bring medication to them in their own home. But it does mean that they're more restricted than they were previously. But they're all getting letters now, and about half of that group hadn't been vaccinated, and they're now being prioritised for their first dose. And the shielding guidance at the moment finally is until the 31st of March, and then there'll be more information for all of that group.
Chris, how confident are you that this
island nation, which is a massive advantage when controlling an outbreak? But they have, in recent weeks, had to lock down one of their cities again, and same in Australia. So it's inevitable that we will see returns of flare-ups of the virus. I'm optimistic that we're going to have a good summer, but we obviously are not there yet. There's still a very significant burden of the disease circulating in the community. We're still seeing upwards of 500,000 to 1/3 cases going through the country each week. And for that reason, we've still got to be cautious at the moment. But I think things are going to get rapidly better. And then it's a question of keeping it that way.
OK. Chris, we've had a question here from Jeff on that issue of vaccines. And he's asking, can any of the current vaccines be mixed and given to the same patients?
And actually, the evidence we have is that it can work very, very well, because basically you prime the immune system with a stimulus of one type of vaccine, and then you come back a period of time later and you consolidate that by effectively testing and stressing the immune system in a slightly different direction with a slightly different vaccines. And there are actually trials, people will be reassured to hear, going on right now. In fact, a couple of weeks ago, the government announced a £7 million trial initiative to test this very question. And there's good reason for doing that, because obviously we don't know that supplies are always going to be there for all the vaccines that everyone's had hitherto, to know where we stand on using different products to reinforce people's immunity if we need to do booster programs or combat variants in the future. So this is probably going to work. It's probably going to be fine.
Finally, how much do you think those moderations in public behaviour will stay, perhaps even when they're not mandated? So things like social distancing and mask wearing.
I think we will see some maintenance of those behaviours. I mean, if you look at the literature on what happens when there's been a crisis, it's most commonly, Rachel, from conflict. You see that people really want to embrace change, and you will see groups in the population that, I suppose, in a simple way, fall into two groups. One that will absolutely embrace the opportunity to go to, large gatherings or even into a restaurant once they're open again, and then another group that will remain very cautious. So I think we can't generalize for individuals. Optimistic, actually, that we've got a generation of children now that have been taught in an even more robust way how to use hand sanitizer and wash their hands, and how to make sure if they've got a runny nose, they're using a tissue. I hope those behaviours will be maintained. And I think in terms of physical distancing, I think we are going to be a little bit cautious about getting close to people even when we can for some time. And I do think my personal view is that face coverings are very useful, and that we may be wearing them in colder months in the future, because we've done so well this year in dealing with flu, and some of the public health measures have contributed to that. So those are some of the changes or not I would expect in the future.
Excellent. No more snotty sleeves, which is only a good thing.
Speak for yourself, Rachel Burden.
Speak for yourself, Rachel.
Linda, I've noticed that you've upped your clock game this week. You've gone down the Chris route. You've got a sort of digital clock there.
Yeah, so I thought I'd provide a public service, but actually it's not me who's providing the public service. It's one of your viewers who very kindly sent me a lovely email and pointed out that he knew the nation envies Chris's clock, but you can make one yourself quite easily. And what you do is there's an app which costs pennies, which is, I've got it here, you can download what's called the atomic clock. So if you've got an old iPad, or which is what I've got in the back here, you download that. If you switch off the thing where your screen goes black after 5 minutes or whatever, you can have a clock like that. Now, I know it's not as snazzy, and I emphasize the word snazzy, as Chris's. But, I just thought I'd show that. I don't think it's going to stay there because I need the iPad for something else. But
you could have saved some money, Chris.
Well, look, I'm going to up my game, because I've been having some conversations with the country's best clockmakers. So watch this space, Linda. I'm going to give you a run for your money. But I'm also going to introduce a handbrake turn on the flower front. Look at this. I thought I can't beat you on the flowers, but I have got this rather stupendous cactus. So beat that, Linda. This is a mammillaria. You can see why it's called a mammillaria, after mammary, the Latin word. But yes, so this is one of my pet cacti.
Right. Okay. I think we'll leave that there.
Yeah.
I dread to think what you're going to get sent by viewers this week, Linda. After that, thank you very much indeed, both of you, for your time. We're a week next weekend.
From competitive clocking to competitive cooking, Saturday.
Good luck, Matt. Have a good morning. That's Saturday Kitchen with Charlie and Naga. This morning.
I cannot ignore the fact that Charlie's hair has got so big now. It's got, but hasn't it, Mike?
The Prime Minister will be giving us a clue about the unlocking of Charlie's hair on Monday in his statement.
I love it.
We'll get in the way of the food, won't it, a bit any longer?
He needs a little bit of, home pruning going on there.
I love the ding-dong there, a bit like in tennis, isn't it? When you're watching one side to the other, Charlie and Naga. But yes.